Hello there, it's Dr. Mazinga, the good guy in here, teaching you about obstetrics and gynecology and answering your woman health related questions. Today we are going to discuss something very interesting. What is honeymoon cystitis? Well, honeymoon cystitis is a misquoted term that is used to describe a urinary tract infection that is acquired after having sexual intercourse. Now, if you are among those women who think every time you meet your boyfriend or your husband, they leave you with an infection, which you have been calling a sexually transmitted infection, this might be for you. Honeymoon cystitis happens as a urinary tract infection that is as a result of bacteria ascending into the pipe that brings out urine from your bladder, which we call the urethra. The commonest bacteria is called E. coli, and E. coli is found normally in your gut. So it can be transported from something close to your gut into the urethra and cause you a urinary tract infection. Who is at risk? All women are actually at risk. Sexually active women are all at risk. But the most commonly, those at increased risk are those that are experiencing intense sexual activity for the first time, women having sex for the first time, women who take long without having sex. So for example, if you have sex once every 3 months. So how does it present? How does honeymoon cystitis present? It might present as any other form of the UTI, only that in the history, you know that you acquired this after sexual intercourse. Please note that honeymoon cystitis is not a form of sexually transmitted infection. Every sexually active woman can have it, and whether you have sex with or without a condom, you can still get honeymoon cystitis. Now, how does it present? First, you might get painful urination. You might urinate more frequently than you've been doing before. You might feel a sudden need to go and pee, sudden need to go and urinate. It's called urgency. But you might also, in severe cases, see blood in urine. The other symptom is low abdominal pain or discomfort just below your navel. How do we treat honeymoon cystitis? Most of the cases of honeymoon cystitis are actually not ones that require treatment. They are self-limiting. But you should seek health care when, one, the symptoms become severe. For example, you have unbearable suprapubic pain below the navel, or you see blood in urine, or you have very much uncomfortable, painful urination. But you can also seek health care if you feel that the symptoms are persistent. Usually they take 1 to 2 days and disappear. But if they are persistent, take 3-4 days, please seek health care. Now, how do we prevent honeymoon cystitis? It's important to practice very good genital hygiene. For women, it's important that after you've done number 2, you wipe from front to backward, and never backward, never from back to front, because once you do that, you're going to contaminate yourself. So good genital hygiene is important. The other way to prevent it is rehydrate. Drink a lot of water, which means you'll pee more times and you're likely to flush the bacteria out. Okay. Number 3 is to urinate or to pee before and after sex. Make that a point. Drink as much water so that you do that. You will prevent honeymoon cystitis. Okay. Now, how do we treat honeymoon cystitis? When you visit your doctor, you are likely to be given antibiotics that last 3 to 5 days. Typically, you will feel better in 3 days, 2 days maybe, but you are encouraged to complete that dose, because if you do not complete it, the chances that the symptoms will recur are very likely. So, today we learned about honeymoon cystitis. Please note that it's possible that you actually got an STI, and the only way you can tell honeymoon cystitis apart from an STI is by seeking the opinion of a healthcare provider who will investigate and be sure that what you have is actually a UTI, honeymoon cystitis. So today you got to know that each woman who is sexually active can actually get honeymoon cystitis, and there are ways to prevent it. Now, why don't you give me some more, many more questions in the comment section. Remember to follow me and to subscribe for more videos like this about your health. Bye bye.